It's time for a Wellness Revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctorate.
Now, Dr. Stephen Hotze. Dr. Hotze's Wellness Revolution podcast is brought to you by Physicians Preference Pharmacy, formerly Hotze Pharmacy.
Welcome to Dr. Hotze's Wellness Revolution. I'm Stacey Banfield here with Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center. We've got a great show today with Dr. Derrick DeSilva. They will be discussing the benefits of full spectrum hemp oil and how it is even better than taking CBD oil. Dr. Hotze.
Thank you so much, Stacey, and thank each one of you for joining us today on Dr. Hotze's Wellness Revolution. You know, I believe that you and everybody needs to have a doctor and a staff of professionals who can coach you onto a path of health and wellness naturally. So as you mature, you can regain and maintain your health, and you've got energy, you've got vitality, and you're enthusiastic about life. Today, I'm so pleased to bring to you a close friend of mine and really an innovator in natural approaches to health and nutraceutical products, vitamin and mineral products, who's going to talk to us today about CBD hemp oil. It's Dr. Derrick DeSilva. Dr. DeSilva, thank you for joining us today.
My pleasure. Thank you, Dr. Hotze, for inviting me.
Dr. DeSilva is an internist. He's an internal medicine doctor out of New Jersey, and he practices there at the Raritan Bay Medical Center. He's also on the teaching faculty of the JFK Medical Center in Edison, New Jersey. He's lectured on numerous topics across the world to various medical conferences that encourage and teach other doctors how to treat patients from a more natural point of view rather than a pharmaceutical point of view. He and I really are on the same wavelength about believing that pharmaceutical drugs are poisons and they make you sicker quicker. And most doctors treat symptoms with drugs that don't resolve the underlying problem. Dr. DeSilva, like I, addresses the underlying problem of the symptoms that you have by treating the underlying cause of those using natural approaches. I have been interested, like many of you have, in the whole concept of this CBD oil. You've heard about it for years. Guests of ours here at the Hotze Health and Wellness Center have asked me on numerous occasions, what do you think about CBD oil? I said, I don't know. It's not in our bailiwick. It wasn't even allowed in Texas up until I think the last session passed a law allowing it to be used in Texas. And CBD oil comes from the cannabis plant. I didn't know or think much about it. But I've known Dr. DeSilva for a number of years, and I know what an innovator he is in addressing health problems from a natural point of view with vitamin and mineral supplementations that he has designed well over 100 to 200 different products, combinations of vitamins and minerals that produce wonderful health benefits in individuals. So I was visiting with him several months ago, and he told me, and we happened to get on the topic of CBD oil, and he goes, yeah, I use CBD oil in my practice. I use a full spectrum hemp oil. I said, really? Now, he would be the last person I would have thought was using hemp oil. And I went, to myself, if Dr. DeSilva is using hemp oil and CBD oil, there must be something to it. I said, tell me about it. What do you use it for? So that got us into a very robust conversation. And I'm going to the point that I said, okay, he has designed a product he's going to tell you about, which is fantastic. And back in December, I said, I tell you what we'll do. I'll private label the product you've developed, and we'll allow we'll just market it and let our guests here at the Hotze Health and Wellness Center try it, see if it works. I was the first one to try it, and I had dramatic relief of a severe problem I had in my neck, and it made me a believer. I was shocked. And so we've used it here at the Hotze Health and Wellness Center, and Dr. DeSilva happens to be in town, and I wanted him to visit with you firsthand and tell you about hemp oil, full spectrum hemp oil, which is derived from a cannabis plant, cannabis ruderalis plant, and the benefits of full spectrum and how this is different or how it's the same as CBD oil. So, Dr. DeSilva, why don't you tell us about what made you interested in CBD oil and the hemp oil, and what you've developed and what we can expect to benefit, how our guests and other individuals can expect to benefit from it.
I think the first thing we need to establish, Dr. Hotze, is what's the difference between full spectrum hemp oil or CBD and something like THC.
Now, THC is the psychoactive drug or molecule that's in the cannabis sativa plant, the marijuana plant that causes people to get high when they smoke it.
Exactly. Then that's the first thing that we have to separate, because this is where all the confusion lies. The confusion lies in the fact that people look at this and they think, oh my goodness, I'm going to get high if I start using full spectrum hemp oil. And that's not true, because full spectrum hemp oil is non-psychotropic, whereas THC is the psychotropic component that gives you that effect. The confusion lies with the legislators, with perhaps some of the viewers out there, and also with physicians. So separating the two is the most important place to start.
Okay, so in what you have designed is a product that's a full spectrum hemp oil. Now, we've heard about CBD. It's one type of remember in the cannabis plants, you have cannabinoid oils, and there are a multiplicity of these oils, of which CBD is one. So what's the reason you didn't design a product that's strictly CBD as opposed to full spectrum hemp oil? What's the benefits?
The first thing we need to establish is what is the endocannabinoid system.
Okay.
Every single person, every single one of you that are watching this, along with your dogs, your cats, your horses, and any other pets that you have that has a vertebra, if you're a vertebrate, you have an endocannabinoid system. So a lot of people say to me, well, what does it do? The endocannabinoid system is called a system of homeostasis. It is a system of balance. If your cortisol levels, for example, are too high, then it will bring them lower. If they're too low, they will bring them up. They follow what is called our circadian rhythms, our circadian patterns of how we wake up in the morning and how we go to sleep at night. So if anybody asks you, what is the endocannabinoid system? Very simple answer is it is a system of homeostasis, or it's a system of balance. Now, the question you asked me was, why didn't I just develop a CBD product?
Right.
As Dr. Hotze mentioned, there are hundreds. We've isolated about 400 different cannabinoids. I personally believe that we are just scratching the surface when it comes to the endocannabinoids that we've isolated. There's CBD, there's CBG, there's CBA, there's CBN, and there's a whole host of other cannabinoids. Each one of those has a particular effect. Now, there's a little bit of crossover between the two, but here's the thing that I want people to understand. When God made this plant, God didn't just make CBD. What he or she did, and I'm trying to be politically correct here, what the plant is that it is a combination of terpenes, flavones, flavonoids, cannabinoids, vitamins, minerals, fatty acids. Pulling out one piece is like saying, okay, I'm going to buy a suit, or I'm going to buy a blazer, but I'm only going to go, you're going to go to the store and you're going to tell the gentleman, I want a blazer, and he comes out with just the sleeve. Well, that's not the blazer. That's just the sleeve. I want to buy the whole jacket. And that's exactly what the full spectrum hemp oil is. It's the whole jacket. It's the whole deal. And the sleeve, the lapel, the pocket, for the pocket square, of course, right? Pocket square. It all works together. When you take pieces out, what happens is you don't get what we call the entourage effect, or the full benefit of all of the pieces that are part of it.
Now, so you made a great decision, and on the market there are very few, if any, that use the full spectrum. How many? There are literally thousands of CBD products on the market. They're everything. You can buy them you can go across the street to the filling station. They got some CBD oil. Who knows where it came from or who made it, or what's in it. There's no third-party verification and validation, which we do, and which Dr. DeSilva has done, because he designed this product. Now, when you design the product, you put in full spectrum. How many other are full spectrum?
There are others that are full spectrum, but here's the difference.
What percent are full spectrum, would you say, in the market?
In the market, there are a lot of isolates out there. I would say maybe 40, 50%.
Or have the full spectrum.
That have the full spectrum. But here's the difference.
Tell us the difference. This is what I was going to ask you about.
The difference is, and this is very important, folks. If you have 2 glasses of water and you take most of the oils that are out there, and they're oils, you drop it into the water, what happens to an oil in water? It floats. Very simple, it floats. The difference between that and what I have designed is that the oil, quote unquote oil, that I have, when you drop that into that glass of water, it is completely soluble. It goes completely into solution. So what's the big deal?
Well, tell them how you did that. You designed this product to do that, and it's a special process. It's liposomal. So describe to them what it means to have microsomal full spectrum oil.
It's not only liposomal, meaning it gets dispersed very quickly because we cover it with what is called a lecithin sphere, but we also have a new technology that I probably haven't even talked to you about, is we have this technology that breaks those molecules up very, very carefully so that it doesn't damage the end product. And it's part of that process, along with micellization, the liposome that we use. All of this technology goes into this product. And this is not a candy that tastes good, that's sweet. No, I'm sorry. This is what I like to call an application as it's meant to be. So there's a little bit of chlorophyll in there. There's a little bit of quote unquote sediment in there. It's not pretty, but it works.
Right.
And that's what I want to get through.
I think it tastes fine. And the real benefit of having it in the liposomal form and being dissolvable in water is that it is well absorbed sublingually under your tongue. So when you take it, you put it under your tongue and you hold it there for 30 to 60 seconds, and it literally gets absorbed through the mucosal lining under your tongue because it is absorbable. It's dissolvable in water, whereas these others that are oil, and most of them are, I don't know, I think there's a very small percentage that are microsomal.
Oh, no, that's a small number.
Very small number. So most of them are oils, and they're not well absorbed. And the absorption rate is, what?
3 to 6%.
Okay, so if you get CBD oil and you're buying that and you put it under your tongue or swallow it, 3 to 6% is going to get absorbed. What's the absorption rate now when we use the liposomal that dissolves in water? What kind of?
Over 50%.
Okay, so.
And I have the studies to prove it,
Right.
Dr. Hotze. And this is what a lot of things, these are the other issue, is people say that it's bioavailable, right? You go to the store and you buy something, and they say it is highly bioavailable. Right. Did you prove it? Did you do a study to prove it? Well, I did. And we're involved right now in other studies on the product that you have. And because that, to me, is the key differentiator when it comes to products, design, and how we utilize this.
Now, we've talked about the product. What do you use it for? What is the benefit of full spectrum hemp oil? What do you use it for?
In my practice, I have 3 primary indications. 3 primary. Number 1, for people that have joint discomforts, you have soreness, you have tenderness, you have muscle tenderness, your neck bothers you, your back bothers you, your toes doesn't matter. Anything that has to do with joint discomfort is what I use it for.
For pain, joint pain.
Joint discomfort. Number 2, I use it in people that are uptight, that are agitated, that are nervous. They can't settle down. Because remember I said in the beginning, it sends the body into homeostasis. it has what are called adaptogenic qualities. So people that are uptight, people that are anxious, etc. That's number 2. And number 3 is for sleep. You will sleep like a baby. Why? Because what it does is that it sends you into deeper levels of REM sleep. I never have trouble sleeping. And in fact, Dr. Hotze asked me this morning when he picked me up, he said, "How did you sleep?" I said, "I hit the bed and I'm done. I'm history." Why? Well, last night I took the full spectrum hemp oil because I'm traveling. I'm here in Houston. And I new bed, new pillow, a little bit of noise that you're not used to. And you need that little help. But for you ladies that are out there that are perimenopausal and menopausal, you're getting up at night, you cannot sleep, let me tell you something. It is unbelievable. And I like what Dr. Hotze said. Put it in your mouth, keep it in there for a couple of minutes. Now, if for some reason you don't like the flavor, mix it in about an ounce of water. Because it goes right into solution. You don't need to worry about that. Mix it in about an ounce of water and hold it in your mouth for about 20 to 30 seconds. Absorption will be pretty quick, and it gets right in. And by the way, I did a study showing bioavailability. And what this study showed was that in 30 minutes, about 75% of this is in serum. So
That's in your blood serum.
It's in your blood. So I take this about 30 minutes before I go to sleep. And our study showed that it stayed in the serum, in the blood, for about 12 hours. At the end of 12 hours, it started to taper off. So I take a dose in the morning, which is about 25 to 30 drops in the morning, and about 25 to 30 drops before I go to sleep.
When we talked earlier about endocannabinoid system, endo means within. We're taking this hemp oil full spectrum, and here's a bottle of it right here. And this is how it works. You take it off. After you've shaken it, you squeeze it, and you get, that would be considered an approximate dose, probably 20 drops. And this is a dose. You use that twice a day to start with if you're an adult. You may need twice that much. You'll just have to see how your symptoms, everybody's different. And then you just squirt it under your tongue and hold it there for 60 seconds. So it goes into your body, and as Doctor mentioned, it goes in and it goes into the receptors for your own endocannabinoid system. You have a cannabinoid system within you that makes 2 products. It makes an anandamide and it makes 2-AG. And those are endo within cannabinoids. This is exo. It's from without cannabinoid. And what happens in your body when you're injured, your body produces anandamide, which goes to the receptors primarily in your brain and in your
spinal cord.
Yeah, spinal cord and your nervous system, and it regulates that. So it helps. Think of it when you get injured or you're nervous or anxious, your switch has been turned on the receptors for the endocannabinoids, and the body makes cannabinoids or anandamide and 2-AG. It goes into the receptor and it turns off the switch, so you're not anxious or you don't have insomnia. It also goes to receptors in the immune system. You have 2 different type of endocannabinoid receptors, CG1, CG2, and CB1 and CB2, and the CB1 is for the brain and the nervous system, and CB2 is for the immune system. So it downregulates inflammation and modulates your immune system. Tell you what I had. I had a bad. I had injured my neck playing golf. Unbeknownst to me, it didn't happen until the second day. At night, I had terrible pain in my left side of my neck, shooting into my shoulder. Dr. DeSilva was here a couple of months back and spoke at our conference here at the office about full spectrum hemp oil. I had already seen my chiropractor. I had been decompressed. I said, you know what? I'm going to start using this. I'll see if it works. The second night I used it, I had been up for 12 nights in a row. The second night I used that, the pain was completely gone. I've had no pain at all since then. Now, I did get adjusted. I did get decompressed at the chiropractor's office, but this was And I asked the chiropractor, how long does it take? He said, normally it takes 20 treatments to get relief. And I'd seen him 3 times, and I really hadn't had relief any time I had been adjusted yet, although I needed it. So he helped with the mechanical problem, but the hemp oil helped with the inflammation, and it was dramatic. Trust me, I use that. That pain was so bad, I said, God, if the pain doesn't go away, take me home. It was so bad. It was like somebody put a knife, and I'd never had a pain like that. And I've had a kidney stone, so I've experienced some bad pain. That was horrible. And the hemp oil helped me, and so we've heard back from our guests. Tell them about your mama. That is a remarkable story.
That I shared this story last night, and I haven't really shared this in any major forum, but I don't mind sharing this because this is pretty remarkable. My mother had a major intracranial bleed about probably almost 20 years ago, and she had both of her frontal lobes removed. My mom should not have lived. You know, she's 84 now. And, you know, she was in a coma for 3 weeks. She was at a major New York hospital. And the doctors were great. You know, I said to them, I want my mom to have, I want to liquefy her CoQ10. I want to liquefy her vitamins. And they said, Dr. DeSilva, you do whatever you want. Put it in the G tube, put it in the gastrostomy tube. And I did. Mom made it. 98% of those people don't make it. So my mom was one of the 2%. And, you know, so it's 20 years later. My mother acts like a dementia patient, and it's hard. I mean, it's difficult. This is the love of my life, which is my mom. And recently, Mom's been getting really agitated. You know, she's 84, as I said, and the only person that she would allow to clean her and help her get dressed and help her in the bathroom is my dad. And my dad's 84, so it's a little bit difficult. So we have help that comes in. And Dad said, look, we got to do something, you know. And I said, Dad, take her to my dad kept saying, I want to take her to the neurologist and get her checked out. I said, fine, do all of that. I spoke to the neurologist. He said, well, you can give her some of these drugs that we have that will calm her down. Like the Xanax and the Ativan and all of that.
All the drugs your doctors have wanted to give you in the past for a host of different reasons.
And I said, Dad, just before we do anything, let's try the full spectrum hemp oil. And my dad just kept saying, and my dad's in the medical field also, kept saying, I don't know. I said, Dad, and I actually got annoyed. And that's not something I typically do with my father, that, you know, I'm 63 years old, that I've ever done. And I really got a little annoyed. And I said, Dad, you need to do this. He said, okay. I said, start Mom with 20 drops. He put it in a little bit of water and gave it to Mom. And he called me less than a week later and said, I cannot believe it. She's better. She's allowing the help that comes in to clean her. She's calmer. She's sleeping better. And she's doing well. And now, I can't say to my dad, I told you so, you know. And he said, look, this is great. This is great. And actually, right now, as we're taping this, my father is on vacation with a bunch of his friends that I'm sure they're drinking all my liquor because they're at my house in Florida, and they're having a great time. So
are they on a golfing trip?
They're absolutely with all his buddies, and you know they're hanging out at my home. Yeah. I'm afraid to go there because I've got to get the place cleaned afterwards. But seriously, if this is something that I feel so strongly about, believe it or not, I have a 4-year-old grandson who's very active. We give him a couple of drops before he goes to sleep. You know, 1 drop per 20 pounds. My son gives him actually 2 drops per 20 pounds. And when I go to watch him, I give him 3 drops per 20 pounds. I'm only kidding. But seriously, this is something that is safe, it's effective, and there are applications. Again, start low and go slow and see how you feel with it.
Well, thank you very much for this great presentation on the full spectrum hemp oil. The reason let me tell you the reasons I like it. One, I know, like, and trust Dr. DeSilva, and I've heard him speak on heart disease numerous times at the various health conferences I have attended. By the way, he is the chairman of the Age Management Medicine Conference, which has over 15 to 20,000 physicians who belong to this who use natural approaches to help their patients get on a path of health and wellness naturally. He's the chairman of this organization. I'll be speaking at it this April down in Florida. So I'm looking forward to that. Thank you for that invitation.
You're welcome.
So I've respected Dr. DeSilva. I know, like, and trust him. And so when he started to talk about CBD oil, or as it is produced, full spectrum hemp oil, my ears perked up. I went, look, he knows what he's doing. He's well respected. I respect him. I'm going to try it based upon knowing and trusting him. And we've done it. I'll tell you what, I'm a believer now. And I wasn't a believer before. I was agnostic about CBD oil. When I used it for myself, I use it every night. Trust me on that. And I'm going to, because I never want to have that pain again. And now I know that I've got some inflammation in my neck. I have degenerative changes in my neck. I don't want that to flare up again, so I'm going to keep it under control.
But remember, we also now have a topical.
Yeah. That's right.
Yes.
So he's just come out with the topical full spectrum hemp oil that you can put on the areas of your body where you're exhibiting the pain in the surrounding muscles. So,
and by the way, no parabens. It's water soluble. So the solubility on this is important. It is completely water soluble. Why is that important? The reason solubility, I didn't do my nails, so don't get too close to this, okay? Solubility is so important because when I put this on my shoulder or on my knee, I don't want my clothing to get messed up. What I want is this to go right into solution. I want it to go, the solubility, it's not greasy and it doesn't stink. This has a very nice odor. It's a mint-like odor, but it immediately goes into skin and it's completely solid. There's no parabens, there's no chemicals, there's no preservatives. This is the good stuff, and it works. Now, I told this story last night that many, many, many years ago, whenever I came out with a new product, I gave it to my mother-in-law to try first. If nothing happened to her, I would give it to my mother. But you know what's happening today, Dr. Hotze?
What?
My son keeps saying, Dad, let's give it to my mother-in-law. So now we give everything to his mother-in-law first, because God rest her soul, my mother-in-law is gone. She's left us. And we gave it to my son's mother-in-law. She put it on her hands.
And she had arthritis.
And she had some serious joint, immobility, and is feeling so much better. So we have a new guinea pig, which I'm very happy about, and it's working.
So here at the Hotze Health and Wellness Center, we offer the full spectrum hemp oil. Again, the reason I like Dr. DeSilva's product is, one, it's organically grown. Secondly, it's grown in the United States. Thirdly, it's full spectrum. It contains all the cannabinoid oils, not just one. And fourthly, it's in a liposomal form so that it is dissolved in water, and it's much more highly absorbed in the system than if you just had regular oils. And also, it's third-party, independently tested for what's in it, and we can show you the
certificate of analysis.
Certificate of analysis. Trust me, you can't get that on most of the other CBD oils. Who knows what's in them? That's very important. And plus, we've done testing, third-party testing on individuals that have taken it. So I know they're getting the product. I know it's rapidly absorbed. And I know from personal experience and from testimonies by our guests that they've had real success with it. So here's what I'd recommend. If you're having problems with pain, whether it's joint pain or muscle pain, maybe even headaches, if you're having problem with pain, if you're having problem with sleep, if you have any problems with anxiety, nervousness, or panic attacks, give it a try. What have you got to lose? You buy a bottle of it. If it doesn't work, you're not obligated to ever buy it again. If it works, then you've got a solution for your problems, and you may want to give it to some of your family members if they have similar problems. So it just gives us an added on in what we do is regenerative medicine, and we want to revitalize and regenerate the cells in our body, keep them healthy as we mature and age, using hormone replacement, good healthy eating programs, treatment of yeast, natural hormone replacement, vitamin and mineral supplementation to help you detox, a good exercise program. All these keep the body rejuvenated, keep it healthy, keep it vital, keep it active. And this is just another adjunct therapy that we can use to help you stay healthy. And this is the full spectrum hemp oil. So I just recommend that you give it a shot. We have it here at the Hotze vitamin store. And, you know, we bought initially 150 bottles, and it sold out like that. I couldn't believe it, you know. And now we just got another 500 bottles, and they've told us already in the first 2 weeks since getting that we sold 100 bottles. So there's a demand for it and a great interest for it, and obviously it wouldn't sell if it didn't work.
Correct.
So the proof's always going to be in the pudding. And some, you know, we might have some conventional doctors go, well, give me a double-blind study. Look, I had a neck problem, and it was killing me, and I was asking God to take me home. It hurt so bad, and I used the hemp oil and went away. That's all I need to know. It's a subset of one. It's a null set. It's a test of one. I had neck pain. I took the hemp oil and went away. Thank you.
By the way, just as an FYI, 125 people die every year probably more, of FDA-approved drugs.
125,000.
125,000 people die every year of FDA-approved drugs. Don't approve this, please. Please don't approve this. So I'd rather stay the way it is.
Right, and this is natural. So people don't die from overdosing on vitamin C or vitamin D or any of the vitamins and minerals, vitamin B. That's not going to kill you. People die from drugs, pharmaceutical drugs, and those are dangerous. So this has no side effects. Of course, even if you take too much water, you can kill yourself, and it's natural. So we don't overdose. There's a certain range that we use in all our natural products, but the natural products don't cause the debility the pharmaceutical products do. And so instead of taking pain medication or anti-anxiety medication or sleep medication when you have problems, pharmaceutical, which are going to make you sicker quicker, try the hemp oil. Either in the sublingual form or you can use it in the topical form, and you can get it here from Hotze Vitamin. Dr. DeSilva, thank you for your
my pleasure
for your great work in this field, and I sure appreciate you. I look forward to all the other new products that you're developing. As a matter of fact, I'm going to work with Dr. DeSilva. He's got some wonderful products he's developed. We do vitamins and minerals here at the Hotze Health and Wellness Center at Hotze Vitamins, and he's got some great ideas on how we can improve the viability, the use of these vitamins, and make them even more effective for you so that you can maintain and obtain and maintain health and wellness naturally. As a matter of fact, I don't want you just, what I'm thinking of, I've changed the terms. I've for 20 years said obtain and maintain health and wellness naturally. We want you to be able to regain and maintain your health and wellness. That's what regenerative medicine does. So thank you again, Dr. DeSilva, and thank each one of you for joining us here on Dr. Hotze's Wellness Revolution.
A special thanks to Physicians Preference Pharmacy, formerly Hotze Pharmacy, proud sponsor of Dr. Hotze's Wellness Revolution podcast.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.